Hello and welcome to another episode of the Health Notebook. Today we have Dr. Saloojee in the studio. He's an ophthalmologist. Dr. Saloojee, welcome to the show.
Thanks so much. Yeah.
Dr. Saloojee, can you just tell us a little bit about yourself, where you've come from, what you're doing at the moment?
Okay, so I'm an ophthalmologist, which is an eye specialist, and I'm in private practice at the moment. And I started my training becoming a medical doctor. And subsequent to that, I had an interest in ophthalmology or eye surgery, becoming an eye specialist. And that obviously takes a prescribed 5-year period. And then after that, I worked a bit overseas to kind of further my interest in my field. And then I started private practice in 2003.
Okay. Now, I know you've come a long way, but just to inform the viewers, sometimes the viewers get confused between an ophthalmologist and an optometrist. Can you just differentiate the two?
Optometrist, when he trains, he does a prescribed 4-year training period just in optometry. So he is trained to prescribe spectacles and contact lenses. An ophthalmologist, on the other hand, studies as a medical doctor, so he trains to become a medical doctor, and after his degree goes on to do a postgraduate degree in ophthalmology. In other words, it's one of the specialities of medicine, and then he trains another 5 years and becomes an ophthalmologist. So he's in fact an eye specialist, and he's able to diagnose eye conditions or problems, and he's able to operate on the eye.
So that is performing surgery as well. Okay, so we're speaking about diabetic eye disease and a little bit about hypertensive eye disease. So we know most people would think that high blood pressure, it's just a problem of the blood pressure, but one needs to understand that high blood pressure affects many other organs. Previously in the show, we've spoken about the brain, we've spoken about the heart and how high blood pressure actually affects those organs. But one of the lesser spoken about systems is the eye. Can you just tell us what actually happens in terms of high blood pressure affecting the eye, or what's the process or the mechanism behind that?
Yes. So there are two important facets of hypertension or high blood pressure in the eye. The first is in terms of the eye being one means of diagnosing hypertension. I often would get patients who sit in my chair and have undiagnosed hypertension. In other words, their doctors or their family or themselves have never known that they have high blood pressure, and I can find features in the eye that point towards the fact that they are hypertensive.
So what you're actually saying is it's not the diagnosis when they do the blood pressure based on the cuff reading, but it's actually when you visualize, when you look into the person's eyes, that you are able to detect that they have high blood pressure.
If a person has had high blood pressure for a few years, there are changes in the blood vessels of the eyes that we can pick up. Okay. And often a person may not have had their blood pressures taken by that stage, or may not have had symptoms of headaches, and they come in to see us for a routine check perhaps, and this is where we pick up that they should be screened or checked for blood pressure. It doesn't mean that they mustn't have their blood pressures read and they mustn't have other tests for hypertension, but at least it's a means by which we can alert them that they should be assessed and checked because there are signs in the eye of hypertension.
Okay, so when we mean by, or what we mean by about high blood pressure is it's the pressure within the blood vessels of the eye. And when this happens, you've mentioned some of the signs and symptoms such as loss of vision, the headaches as well. What are the other signs and symptoms that that you can actually highlight that the person might have?
Sure. So we discussed how high blood pressure can be diagnosed sometimes, if it hasn't been already, by other means, by looking into the eye, because the blood vessels over time undergo specific changes. Okay. They become narrowed. Some blood vessels may have a tortuosity or a turn in them that tells us. So apart from diagnosis, there's the whole effect of hypertension on vision and the eye. For instance, we may have a scenario sometimes when the blood pressure is elevated that people may have blockages of blood vessels in their eye.
So that means they can't see?
They would present with sudden loss of their sight, or their sight may go down suddenly. And this may be in effect a blockage of a blood vessel in the eye, either an artery or a vein. The other thing that we see quite relatively commonly is when people's blood pressure sometimes becomes very high. In other words, it goes into the 200s. Extremely high blood pressure, what that can do is that can actually swell the nerve of the eye.
Okay.
And the nerve of the eye, as you know, is called the optic nerve. And when the optic nerve swells up, this is when it can give visual problems.
Okay, and I mean, obviously for the person this can happen at any time. So the person can be driving as well, and then it poses not only a risk to the individual but to other road users as well. So I mean, that's actually important that one, if you have high blood pressure, your eye should also be checked on a regular basis. And how would you, or what is your recommendation in terms of checking an individual's blood pressure in relation to having your eyes checked? Is there a set period of time, like every year, if you have high blood pressure, or what would you recommend?
You know, and I think the main people who would be assessing and managing and treating a person's high blood pressure would be the person's GP.
Okay.
He would be the first and most important line of treatment for high blood pressure. If the GP has had a problem trying to control a person's blood pressure, he would then refer on to a specialist, a physician.
Okay.
So those two individuals usually are the ones who control blood pressure. We as an ophthalmologist would come in the sense that we would suggest that a person has a routine eye check once a year.
Okay, okay. So what we have is the high blood pressure affecting the eye. You've made the diagnosis while you actually looked into the person's eye. Is there any other additional test that one would conduct in order to confirm the diagnosis that this high blood pressure is affecting the eye from a ophthalmologist's point of view?
Sure. So you know, what we commonly do is certain pictures of the eye, the blood vessels of the eye, and we look quite closely at those pictures, and those would tell us or show us where the changes are in the blood vessels of the eye. Okay. And those changes then we obviously follow with time to see if they're worsening or they're reducing. If a person, for instance, has had a blood vessel blocked from high blood pressure, that person would then need specific treatment to try and reduce the effect of that, so that this loss of vision that they have had over time diminishes, and we can then try and control it as much as possible. But I should bring in also at this stage, an important risk factor for a condition called glaucoma.
Yes.
Is high blood pressure.
Okay.
So high blood pressure, when one has high blood pressure, when we do a routine yearly check, we would naturally check for glaucoma.
So what does this actually mean?
This means that high blood pressure puts a person at risk for an important ocular condition called glaucoma.
Okay.
And glaucoma, as you know, is a silent condition. It is a subject for another day altogether.
Yes. Okay.
In itself, glaucoma has so many things about it that are important for people to be aware of. But the important thing to say is that this yearly check that we do in a person who has diagnosed hypertension will entail checking for glaucoma.
Okay. Okay. So now we know that we have one illness known as high blood pressure, but this one illness is a risk factor for many other eye conditions. Yes. Okay, so you've mentioned glaucoma, you've mentioned about the nerves being involved. What other eye conditions can high blood pressure lead to?
Yes, quite right. Another important condition which I see quite often, quite commonly, is people coming in with sudden double vision.
Okay.
In other words, they say to you, I see two of each thing. The two images may be next to each other or one on top of the other, but this is called double vision. In our medical terms, we call it diplopia, okay. Double vision. Okay. And a risk factor for double vision or diplopia is high blood pressure. So if a person's high blood pressure has been poorly controlled over years, the tiny blood vessels that supply the nerves that cause the eye to move are affected. And as a result of that, the person may have sudden double vision because one eye doesn't move exactly like the other. They are not in sync as such.
Okay. So is the treatment available for some of the conditions? I mean, is it reversible or is there no end in sight?
There are some conditions that a person presents with that may be very severe, and we sometimes fail to get the vision back. It may be a permanent loss of vision, but by and large the majority we can try and control the amount of loss of vision a person has had by doing time-use treatment at the right time. And this time-use treatment may entail things like drops in the eye, it may entail things like laser therapy, and it may sometimes also entail surgery.
So what we actually mean here is that you would provide the treatment for the eye, but it doesn't mean that the person needs to stop his medication. He also needs to ensure that he's compliant with his medication in terms of his normal high blood pressure pills. Because if he stops it and he assumes now, okay, everything's going to go away, my eyes will improve after the ophthalmologist has improved, I mean, that is the wrong perception. He still needs to continue with the normal medication.
I think the viewers should understand that the basis of the problem in the eye is the high blood pressure. So the basis of the problem is controlling the high blood pressure first. And that doesn't stop once you start receiving eye treatment. One still has to follow up with one's GP, one's specialist who is dealing with the high blood pressure to make sure that that's under control. Because our success rate on treatment is also influenced by the good control of the blood pressure.
Okay. And that is patient compliance.
Absolutely. Compliance meaning that they should be taking the medication on time, they should be following up with their GPs on time and their specialists on time. They should be watching certain measures dietary wise that they should be following to try and ensure that their blood pressure is not uncontrolled.
So thank you very much for sharing this important information in terms of high blood pressure. As the viewers are aware, high blood pressure is not just having the high blood pressure, it's a multi-system disease. We're going to touch a little bit on the next topic, which is diabetic eye disease. Now, being a diabetic, it is one of those illnesses like high blood pressure that can affect other systems as well. Now, diabetes can affect the eye. Can you just explain to the viewers how does it affect the eye?
Very similarly to high blood pressure, the basis of problems that diabetes causes is that diabetes is a condition over time that affects blood vessels. And as I explain to my patients, one has blood vessels all over the body. These blood vessels go and give important nutrition and oxygen to various organs of the body. And these particular organs are affected because their blood supply is affected. Now, if you think about it, Ziyaad, the only blood vessels in the whole body that one can actually view are the eye blood vessels. Okay. You cannot view the blood vessels of the heart, of the kidneys, without having to do special tests and investigations that need a person to be admitted to hospitals often. But with the eye, we've got a window into a person's blood vessel supply and the state of health of their blood vessels of the whole body. So like hypertension, in diabetes, the blood vessels in the eyes are affected. And as a result of that, other parts of the eye can become affected because its blood supply is affected.
Okay, so what actually happens in terms of how will it present? Now, yes. I mean, so what will a person...
The walls of the blood vessels are damaged, and so one of two things can happen in a simplistic explanation. One of two things. One is the blood vessel may not allow blood to flow through it. So it's a closure or a blockage. Now, if you have an important organ like the eye, which requires a good blood supply, and suddenly it hasn't got a flow of blood, that will affect one's vision. Because the sensitive cells in the eye that make vision suddenly have not got the blood supply they require. That's number one. And number two, apart from blockage, these blood vessel walls are damaged to such an extent that they leak. So the blood vessel actually leaks, and that leakage accumulates in parts of the eyes it shouldn't accumulate at, and that can cause loss of vision.
And loss of vision, okay. And besides loss of vision, what else can the person experience? Would there be symptoms of diplopia as well?
Yes. Very commonly, and I see this very, very commonly, many patients who are still not diagnosed with their diabetes, in other words, they're not aware they have diabetes.
Similar like high blood pressure.
Like high blood pressure, or patients, for instance, whose diabetes is poorly controlled. What happens with them is their glucose levels goes very high. It may go to 17, 18, bearing in mind that normal is about 3 to 6. 3 to 5.5, somewhere there. And if they're running at glucose levels in the 16, in the late teens and the early 20s, and sometimes even up to the 30s, it can happen, then their typical way, that the way they would see us, is they would complain of intermittent blurring of vision, especially for reading. So they would come to us saying, Doc, recently over the past few months, I've had a situation where, I see sometimes clearly, other times I can't, especially when I try to read a book. And we'll examine the eyes and we find that the blood vessels are not affected, but we find that high glucose has had an influence on the focusing ability of the eye.
Okay.
That focusing ability will come back to normal once the sugar level comes back to normal.
Okay. So what we have now is the sugar levels being very high. So diabetes now we know affects the eye. So what are the diseases that diabetes can cause? So we have diabetes. What are the illnesses of the eye that it can cause?
Okay, so very similar to high blood pressure, apart from the leakage I told you about. So we see effects of the leakage, which is fluid accumulation in the structures of the eye. We see a situation where there's a blockage of some of the blood vessels. Then we can have the similar situation to what we've had with high blood pressure, where the vein or the artery can suddenly block up.
Okay.
We also have a situation where it puts patients at higher risk of glaucoma again.
Okay. So like high blood pressure, we have diabetes, which is another risk factor for glaucoma.
That's it. And then we have this situation, as I pointed out to you, where a person can present with sudden double vision. Okay. And this may be due to diabetes as well. Okay. So the two are very similar in the sense that, remember, both of them affect blood vessels, essentially.
Okay. How is a cataract related to diabetes? Is there any relation?
Yes, quite right. A cataract is one important cause of reduced vision, and one important cause of a cataract is diabetes. So I have many patients coming into the practice who come in because they can't see in one eye, and we find that they have a cataract, usually at a young age. Remember, most people get the cataracts at an advanced age, when they maybe perhaps 70 or 80 or 90. But a cause for cataract at an earlier age is often diabetes.
Okay, just explain to our viewers what is a cataract.
Okay, that's a huge subject. Yes, that's a subject for another talk. But essentially what it means is that one has a lens in one's eye. This lens is clear, almost like clear water, but it's in a form of jelly. And imagine that clear structure now starts losing its clarity. So it's almost like the lens in a camera, which becomes foggy now, and it takes on a yellowish to brownish tint or hue or color, and so it means light doesn't pass through unobstructed like it does with a clear lens. Okay. So the person would experience this as a generalized haziness or blurriness of his vision.
So we know that diabetes affects the eyes in different ways, and you've mentioned cataracts. We will be discussing that on another show. So just to go back to diabetes, just going back to diabetes and the eye, what are the treatment options available for the viewer out there if they do have diabetic eye disease?
Sure. So importantly, one must not stress that I always consider a routine yearly check as one form of treatment. Okay. Because essentially it tries to nip the condition in the bud. It tries to prevent problems that require further, more expensive, more elaborate treatment. Okay. So,
can this be done by the GP, or would you prefer?
No. Certainly the yearly assessment that needs to be done, my advice is that that's done via a trained eye specialist, an ophthalmologist. Okay. There is also the controversy of whether optometrists should be screening for diabetes. My personal opinion on that is they're not at this stage as a general grouping adequately trained to be able to give an assessment for whether a diabetic should be monitored or should have treatment. So the important thing is, if your GP or your optometrist or your physician thinks that you have diabetes or is diagnosed diabetes, then you should be coming for a yearly eye assessment to an ophthalmologist, an eye specialist.
Okay, so it should be mandatory. You should be seen by a eye specialist. Okay. Besides the treatment that you'll provide, what are the other options or
certainly. So the yearly assessment will pick up changes or problems that people have, and this is where various treatment options are explored with the patient, depending on their circumstance. And it's a wide variety in general. Okay. It may involve asking the GP or physician to get better control of the diabetes.
So that is treating the disease like high blood pressure?
Treating, and that's foremost and of utmost importance. I think more than any eye treatment is the control of the diabetes, because it will influence how successful we are with our treatment as well. Okay. So that's most important, and then comes the specific treatment for the eye, and this may entail topical eye drops.
Okay.
Or it may entail laser treatment.
Okay.
And the third arm is surgery.
Okay. Just before we end the show, what is the most important take-home message that you can maybe give to the viewers in terms of high blood pressure, in terms of diabetes?
I had a patient, for instance, who came in this morning who has been treated by the day hospitals. She's obviously seen various doctors at various stages. She was diagnosed and begun on treatment for her diabetes and hypertension almost for 10 years now. And she came to us now because she's got two major problems. And I was referred her by the renal physician, the nephrologist, okay. And she's being seen by him because her diabetes wasn't well controlled, she has end-stage kidney disease and she needs expensive dialysis now for the rest of her life.
Okay.
But the reason he referred her to me is because she's got poor vision. Now, she's got extremely poor vision, most of which, unfortunately, we cannot get back for her. I have now had to schedule her for expensive, intricate eye surgery, the results of which unfortunately are not going to be good. Okay. So all because from the onset of her diabetes, nobody thought that she needs to have her eye checked.
So that just highlights
the fact that eyes are often a neglected field in high blood pressure and diabetes care. It is the last vestige. When you think of a person who needs care, you'll say, go to your kidney specialist, go to your heart specialist, you need to check your heart, go to your neurologist. But the last thing people think about is the eye. The reason for this is it's only when the eye gives you a problem, that's when you decide you need treatment, and by that time, it's often too late. Okay. So the take-home message is you need a routine yearly check as a diabetic.
Okay, so yeah, that moves to the whole thing of preventative aspects of medicine, preventing the signs and symptoms, and actually picking it up before it actually develops to prevent the individual from losing his or her vision. Dr. Saloojee, it's been a great pleasure having you on the show. We hope to see you next time when we will be discussing the whole concept of glaucoma and cataracts. Thank you very much.
It's a pleasure.
Stay tuned for another episode next week, same time, same place. Thank you for watching.